My dad was a doctor. He was actually an orthopedic surgeon. And I grew up in a small town in the Philippines, not unlike La Grande. And being a small town, my dad did more than just being an orthopedic surgeon. He did general surgery, he did primary care, and he would bring me to his office when I was a little girl, and I would sit in the corner and just watch him talk to patients and treat them, and I was just amazed, I guess, and fascinated. Sleep medicine is generally a young specialty, but it is becoming more and more important. We estimate that 26% of American adults ages 30 to 70 have actually sleep apnea. 3 in 4 Americans have sleep problems. And the most common condition that I am asked to evaluate is obstructive sleep apnea. It can cause symptoms such as snoring, drowsiness, non-refreshing sleep, memory issues, even mood issues. And the issue with sleep apnea is that when left untreated, it can cause so many other diseases, and that includes hypertension, coronary artery disease, diabetes, cardiac arrhythmias, particularly atrial fibrillation. And as a neurologist, I can also say that it does increase the risk for strokes and even dementia. My favorite part about taking care of a patient is that when they come back and they have used CPAP for even one night, so I would get phone calls where patients would say, "That was the best sleep of my life," or "CPAP changed my life," and that always makes my day. How did I get to Union County? Well, I knew a couple of providers that already work at Grande Ronde Hospital, so I came for my interview, and right away, the people were so warm, the area was so beautiful. I was somewhat worried coming from the East, and I was afraid I was going to be treated as an outsider, but I was not. I was warmly embraced. In a matter of a few weeks, I had so many friends. One of my favorite things is the weekend when I'm off and I just walk onto my kitchen porch with my coffee and just look at the mountains. I guess it makes everything worthwhile.